I grew up with these two girls, so I know that they're fellow Hanson fans. From the Guam Regional Medical City Customer Relations Manager Joy Garcia. Hafa-day.
Hafa-day.
And we have a lead training partner, Ashley Delgado. Hi.
Hi.
And of course, my former boss, actually, Kevin Kerrigan from GRMC. Hafa-day.
Good to see you, Phil.
So we are celebrating. We're in a celebratory mood because today is the official first anniversary, birthday of the Guam Regional Medical City. Congratulations, everyone.
Thank you very much.
And what are we celebrating today? Because there are a lot of milestones and there are a lot of really good goals that you guys have reached in the year you've been open.
Yeah, today, so this day, July 1st, marks the official day that we opened our doors for outpatient services.
Mm-hmm.
So we conducted our blessing ceremony, and it's a very, very big milestone for us as far as our mission and our vision for the people of Guam.
Yeah.
So we're excited.
Well, and again, in that year, Kevin, you guys haven't just been, sitting on your hands and resting on laurels. You've been opening new offices, offering new services, and that's translating to a lot of patients being served.
Exactly. I mean, 1 year ago today, we opened the clinical services, as Joyce said. We saw 7 patients on the first day. Since then, it's been over 10,000 patient visits. Some of those have been repeat visits.
In a year's time.
In a year's time. And the vast majority of them, 9,602, have been to the emergency room.
So out of the 10,000 visits, 9,600 are treated in the ER. And I'm guessing with it being ER patients, we're not talking about like people with Cadillac health insurance plans, right?
61% of those emergency department visits have been Medicaid, self-pay, or MIP patients.
Wow.
3,806 Medicaid patients, 1,130 self-pay, 783 MIP. So 61% of the total visits to the emergency department have been in those categories.
I remember Margaret Benzon saying that, part of the vision for GRMC is to give this quality of care to people, and that you don't have to be the cream of the crop, the haves and not the have-nots. That it should be for everyone, and I guess that's a pretty, that the vast majority of your patients are the people that would need this and not necessarily have the ability to go to a private hospital in the States.
That's right.
Okay, so since you guys are doing all this great stuff, serving everyone, I definitely think there is cause for celebration. What's happening? The birthday's today, Ashley. So what's happening today?
Today at 3:30, we're having a birthday cake celebration for employees.
Okay.
Our theme is We Are One.
And I'm guessing I remember that SPG theme song, and so I'm guessing there's a little bit of dual meaning behind We Are One, right?
Definitely, yes.
Okay, so unity and also 1 year old.
Definitely.
Yes. Okay.
Yes.
So a cake celebration in the afternoon, and you also got something to say thank you to the public today, right?
Yes. So we're gonna have a wave. We're gonna be waving to the people of Guam as they pass by. We're gonna be on Route 1 and Route 3.
So if you see people in blue shirts, it's not anything to do with an election.
Yeah.
Yes.
On Route 1 and Route 3.
Saying hello to everyone.
Saying everyone, and you can turn in there to go to GRMC.
Yeah.
Yes.
We'll be
Come
holding
and
big
have a look.
signs saying
Okay.
We Are One.
Definitely.
Yeah.
Okay, but that's not all, right? In the year that you guys have been opened, you've delivered babies, you've offered surgical opportunities and options that really you may have had to fly to the States for.
Yes.
And so I'm reading here that you guys have cataloged those milestones, and that we're going to be doing some sort of exhibition for it.
So part of the festivities for the month of July, we are going to be opening, our doors are always open, but this is more of an attraction, just in case, people didn't know too much about it. So it'll be stationed in the main lobby of the hospital. We're going to put up actual stations as if you're going through a science fair. So we'll have lots of details posted. So as such, so like our first baby, our first surgery, the bits and pieces of our blessings, our grand opening.
Okay.
Yeah.
And when we're talking about you guys being a year old, still the new kid on the block. I'm coming up on my 2-year anniversary here, and I still feel like just a little bit green. And so let's try to refamiliarize people with what you guys provide, because one of the things that you can hang your hat on at GRMC is there are a couple of first and onlys, right, that are available at the regional medical city.
Cardiac care, cancer care, diabetes care.
And just a regular, inpatient, that hyperbaric chamber. Diabetes, right, is one of the big diseases here on Guam, and when we're talking about hyperbaric chamber, the first thing that comes to mind is Michael Jackson, but that's not what we're talking about. It improves circulation for people that have those lower limb extremity issues when you have diabetes.
Dr. Acuna
right?
is probably one of our busiest physicians, and she's seen dozens of patients in the hyperbaric chamber, which provides pressurized 100% oxygen to help speed slow healing diabetic wounds, and she's had a lot of success.
So again, you mentioned it's like one of the busiest parts of the hospital, and the best part is you don't have to wait to see it on an emergency basis. You can just, like a regular doctor, you
book an appointment. And she's been very busy and very successful.
What other departments and what other services are you wanting to highlight, Kevin?
Cardiac care. We have a cardiac team that includes Dr. Holland, pediatric cardiologist Dr. Yousefi, Dr. Shaker. Dr. Holland specializes in implants. Dr. Shaker specializes in stents. And our pediatric cardiologist, Dr. Yousefi, looks at children who have.
So we're talking about adult and pediatric open heart surgery that you don't have to leave Island for?
Don't have open heart surgery.
Okay.
But we do have, stent implants.
Which is one of the things that you had to go off Island for, isn't it?
Many people do go off Island for it.
Again, just trying to highlight that, that this is a choice that we have now.
Yes.
Okay.
So stents, implants of pacemakers and that sort of thing, and Dr. Yousefi looks at children who have heart disease problems.
You still have that sleep specialist here?
Yes.
Oh, see?
In
another
the neurology
thing.
Department,
Yeah, so...
Dr. Hale.
I'm sorry, I'm just thinking about my brother and how he might want to go for his snoring. We're in a good mood here because the Guam Regional Medical City is turning 1 today. Today is their birthday, and there are a couple of ways that you can help to celebrate. They're going to be waving at the corner of Route 3 and Route 1 at 4:15 today. If you have some spare time between the 18th and the 20th, you can go to their main lobby, and there's going to be an exhibition that you can help enjoy. And what else? Liberation Day parade, right? That's always a good opportunity for organizations to interface with the public.
We're working with the Delgado Mayor's office.
Oh, okay. So you're going to be part of the Delgado float?
Yes.
Oh, perfect.
We're going to be teaming up with Delgado Mayor.
Community float.
Okay. Yeah. Well, that's great. And let's see. I see cultural dance groups are going to be a part of it. Okay, and let's give a shout out to the decorator, Bo Santos. Because it always helps to do that.
And Arta Buddha, who's our multimedia specialist.
Oh,
who's
wow.
helping with the design.
Okay.
We're splitting it 50-50, cost and design all around.
You mentioned, let's see, the focus for this month, appreciation for employees, and we're talking about wellness walks. What's that?
Yeah, so currently what we have going on, it's Walk the Mall with GRMC. So our marketing specialist, Karenina Dueña, she heads this walk every Thursday at 10 a.m. at the mall. So whoever's at the mall at that time, they're more than welcome to join. We do give back some incentives like T-shirts, pillboxes, and such.
Oh, cool.
So what we want to start now is we're going to be working with our rehabilitation manager, Keith Chan, to create a tailored walk for, the older individuals, just so, we can avoid the stairs. So we wanted to do exterior and interior walks, wellness walks. Just something that's going to be a part of our wellness program, including employees and the community of Guam as well.
Okay, well, again, yet another new program being developed by the Guam Regional Medical City. They're turning, they turned 1 today, and again, helping to celebrate a whole bunch of milestones, a whole bunch of ways that you can receive quality care here at home. I want to again thank Joy and Ashley and Kevin for coming in. I really appreciate it. The time. A caller wanted to find out the times of the mall walks again. Joy.
Oh, sure. 10 a.m.
Okay,
every Thursday.
10 a.m. Thursday at the Micronesia Mall. That's when those guided walks, and again, there's some incentives like pill boxes and T-shirts and stuff. Okay.
We meet in the center court.
Okay, meet at the center court, 10 a.m. on Thursdays for those wellness walks. And if you have any questions, GRMC readily available right off of Route 3, right on Route 3, off of Route 1 is what I'm trying to say. And retail spaces, family centers, you have a whole bunch of stuff, right?
We have 2 retail spaces on the ground floor.
Yeah,
and the Boca Cafe and on the lower level, and
you can get a bite to eat, like a nice fancy baby bottle or something like that, right? It's, for that stuff that's going on. 9 minutes left until the top of the hour. Thanks again for coming in.